First, let's go over the basic step-by-step operation of a combat application tourniquet in this video.
Unwrap the tourniquet and apply it 2 to 3 inches above the wound. Do not place the tourniquet onto a joint. Go above the joint if necessary. Pull the free end of the tourniquet and wrap it until it is tight. Wind the windlass until the bleeding stops. Secure the windlass in place. Note the time the tourniquet was applied and write it down, if you can, or tell first responders when they arrive.
The Combat Application Tourniquet, CAT, is a widely used medical device designed to control life-threatening external bleeding by completely stopping the blood flow to a wound. Tourniquets are often used in emergency medical services alongside other bleeding control methods because it's difficult to maintain consistent pressure for an extended time using simple compression. The Combat Application Tourniquets avoid disrupting a forming clot and allow safer patient transport. The decision to use a tourniquet needs to be made quickly, and it's important to apply it correctly. Here are the main components of a Combat Application Tourniquet. Tourniquet Strap. This is the main strap of the CAT tourniquet. It is typically made of durable nylon or similar material and features a one-handed application mechanism, which allows the user to tighten it quickly and securely around the injured limb. Windlass rod. The windlass is a rigid rod or stick located in the center of the tourniquet strap. It serves as the lever that tightens the strap when turned. This allows the user to apply the necessary pressure to occlude the blood flow to the injured limb. Windlass clip. The windlass clip is a plastic or metal piece that secures the windlass rod in place once the tourniquet is adequately tightened. This prevents the tourniquet from coming loose and maintains the pressure on the limb. Safety buckle. The CAT tourniquet typically has a plastic buckle that serves as a safety feature to prevent accidental release. It helps ensure that the tourniquet remains in place until it's intentionally removed. Time indicator. Some CAT tourniquets have a time indicator on the strap, which is used to record the time when the tourniquet was applied. This is important because tourniquets should not be left on for an extended period to avoid complications such as limb damage or necrosis. Velcro or hook and loop fastener. The tourniquet strap usually has a Velcro or hook and loop fastener that helps to secure the strap in place after it's tightened. Here are the step-by-step procedures for applying the Combat Application Tourniquet. Step 1. Place the tourniquet around the injured limb, 2 to 3 inches proximal to the bleeding site, directly to the skin. Step 2. Pull the strap tightly around the limb but not over the rod, and fasten it back on itself with the Velcro. Pull the strap tightly enough that the tips of 3 fingers cannot slide between the strap and the limb. Step 3. Twist the windlass rod to further tighten the strap until the bleeding is controlled. Step 4. Secure the windlass rod inside the windlass clip to lock it in place. Step 5. Check for bleeding and distal pulse. If bleeding is not controlled or distal pulses are present, consider additional tightening or applying a second CAT above and side by side to the first. Step 6. The time of application should be recorded. Now, let's recap the basic step-by-step operation of a CAT tourniquet.
Unwrap the tourniquet and apply it 2 to 3 inches above the wound. Do not place the tourniquet onto a joint. Go above the joint if necessary. Pull the free end of the tourniquet and wrap it until it is tight. Wind the windlass until the bleeding stops. Secure the windlass in place. Note the time the tourniquet was applied and write it down, if you can, or tell first responders when they arrive.
Take-home message. The Combat Application Tourniquet, CAT, is a device used to control severe blood loss from the body's extremities. It is a simple yet effective tool that can save lives if used correctly. The CAT is designed to be used in both military and civilian settings and is the official tourniquet of the U.S. Army. Remember to follow the step-by-step procedures for applying the CAT and use it as a last resort for blood control management.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.